Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about a very difficult, hard topic, and that is COVID in kids, specifically deaths in children, and the amount of focus that we're putting towards kids and how much does it warrant where we're at. And especially with the vaccine being approved from 5 to 11, we really need to look at what the risk is for kids here. And there was a recent article just put out in Pediatrics, and it looked at deaths in basically pediatrics, so under age 21, and looked at it from February 12th to July 31st, and really looked hard at the deaths that had occurred in the kids and what were the risk factors for them. And really what we need to do is focus on those risk factors so we can fix them. And that's the frustrating thing. We're not having any of these conversations. We are just as we are with adults, we're looking at the fear factor and instead of looking at what we can control. And there were, and again, anybody can agree that the death of any child is devastating. And the reality is that they happen, and we have to look at our response to them. And instead of panicking over that, what can we do to prevent this? And we have done zero to talk about what we can do to protect kids throughout this whole endeavor, even though it's very clear, just like it is in adults, which kids are at risk. And so they looked at across the jurisdiction, so basically the entire United States, specifically took numbers out of 25 jurisdictions. That's because out of 20 jurisdictions, there were no pediatric deaths. And this is under the under 21 age group. Of that group, there were 112 deaths, and the average age was 17 years. So these aren't young kids, these are teenagers. 86% of them had an underlying problem. Obesity was on top of the list. Asthma, which is not hard to fix, not an easy one to fix, but certainly there's things we can do to prevent it on the front end. Developmental disorders, again, not anything you can fix, but the obesity issue we certainly can address in kids. And the other thing is 74% of them were Black or Hispanic, and that screams vitamin D deficiency to me. And I've said this before, we are not educating people on taking vitamin D from a public health perspective, despite the data on it. And we look at darker skinned individuals, and their physiology doesn't differ all that much, but their skin color and their ability to generate vitamin D does. It's just a travesty, inexcusable, that we have not gotten the message out for these kids to be taking vitamin D. And certainly manage weight is another big one. When we look at so these are controllable factors. The vitamin D alone could have had a huge dent in this. But we've been so worried about finding a treatment or a vaccine that we haven't been paying attention to the elephant in the room of what could potentially be helped. To put everything in perspective, we've logged 700 COVID deaths over almost the 2-year span of time. That's through November 6th, starting January 2020. And to put that in comparison, so we're looking at maybe 350 a year. To put that in, it's at the lowest. It's the very bottom of what's killing our kids. Motor vehicle accidents are top of the list, 4,000 a year. Just put some of this effort towards making sure kids are properly restrained in car seats. RSV, respiratory syncytial virus, kills upwards of 500 kids a year in, year out. The flu, reported generally around 188 deaths a year. That number is probably closer to 600 because it's underreported. These are things that we need to put things in perspective when we look at our response to that. We should be panicking about the 4,000 deaths we have in accidents. What can we do about that? When it may be as simple as giving vitamin D to these kids, and we can cut out a huge chunk of the kids that we're losing, and that's what remains frustrating for me. And certainly then people will throw, what about the kids with COVID, and what about long COVID? Long COVID kids, I've got another video queued up that I'm going to get into this. The entire long COVID thing is a whole nother topic altogether, and I think we're going to find that it isn't what we think it is, and that certainly any viral infection ever has created problems in adults and kids, and so this isn't anything new. So as always, I'll post a link to this particular pediatric journal article in the discussion or the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.